For our final chat today, we're delving into an important and often misunderstood aspect of sexual wellness, which is orgasmic disorder. It can have a real impact on confidence, connection, and overall well-being. Once again, I'm joined in studio by Dr. Mark Opperman of the T Clinic to help us understand what's really going on and how it can be treated, as well as how we can open up conversations around intimacy with our partners. Mark, so orgasmic disorder, I think this is one that in the movies we laugh about, like she couldn't orgasm, she lies about whatever happens, blah, blah, blah. But it's a real issue and it can cause some deeper concerns and problems within a relationship. So tell us exactly what this means.
Michael, orgasmic disorder is when you cannot achieve an orgasm, when the orgasm is either too quick or very much delayed. And I like what you said in the movies. Actually, for me in the movies, it's always so frustrating when everyone just orgasms together on cue, which really doesn't happen.
Yeah.
So I think I want to split them in two. I want to look at female orgasmic disorders and male orgasmic disorders. So female orgasmic disorders, or anorgasmia, is where the body goes through the normal sexual response cycle. So there's the excitement, there's the plateau phase, but we do not achieve an orgasm. And it's actually quite common in women, especially in younger women.
Okay.
Sister Elise always says, and it's actually true, that for women, achieving an orgasm is a learned experience.
Okay.
It just doesn't happen spontaneously.
Yes.
It's something that takes practice. That's why it's so important for women to actually know their bodies and know what they like. And, it brings communication as a part of treatment for orgasmic disorders for women really, really to the forefront. There's something that's also quite unknown of, and that's post-orgasmic dysphoria, when after an orgasm, there's the sense of sadness or illness, physical illness, where they really, really feel fluey and bad, or sad and down and depressed. So that's also one that we need to know about.
Okay.
Treatment for orgasmic disorders in women, a little bit more complex. I think again of platelet-rich plasma treatment for women, especially to treat conditions of the vulva, the vagina itself, where it rejuvenates nerve tissue, etc., which can create sensitivity. Some of the causes, again, certain medications and medical conditions can lead to that. And as with any kind of sexual disorder, one disorder can lead to another. So if there's no interest and desire, and you do go into a sexual experience, you might not have the orgasm because you actually don't really want to be there, or you're not into it. And then pain disorders can also lead to anorgasmia. So for women where your sexual response is a linear response, there's excitement, there's a plateau phase, orgasmic phase, resolution phase, it can happen at any one of those, and it can cause a problem with erections. For men, I actually think they don't realize that premature ejaculation is one of probably the second most common form of sexual dysfunction. And that's where there's an orgasm the moment that there's penetration. And it really is embarrassing. It really becomes uncomfortable, and it's a big problem for guys. But we also have delayed or even absent orgasms where it takes forever, and eventually it's just, okay, what?
Enough already.
Please give up.
So Mark, I mean, there are a lot of differences there? So for a woman, it's delayed or not happening. For men, it's too quick or it's
Sometimes,
delayed or
yeah.
not happening. And I can imagine this, either one of these could just cause massive frustrations
Absolutely.
for yourself as well as your partner,
Yes.
right?
Yes. Michael, I think one of the ones that I treat most commonly in my practice amongst the guys is premature ejaculation. And it's actually quite simple to treat. We usually use some kind of topical numbing cream for them.
Okay, okay.
There are prescription medications, but it's prescription medications in the antidepressant ranges.
Ah, okay.
So, it decreases the sensitivity, but can also have an effect on your libido. So
Yes.
it's not commonly used.
Okay.
Well, definitely not in my practice. We rather focus on regenerating nerve tissue, cognitive behavioral therapy, where we teach patients how to delay that. But the most common one that I use in my practice for the guys with this is a combination of platelet-rich plasma therapy and teaching them that you can speak to your partner and say, let's do something else in the meantime.
Right.
It's still sexual, but it's not necessarily penetration.
Okay, okay.
So, there's ways of working with that. That brings back a little bit of confidence and self-control, etc., etc.
And again, you spoke about on the female side, women learning about their body and
Yes.
how to find whatever it might be that would help to stimulate pleasure, be in control, I guess.
Yes.
And that for the guys as well,
Can
be
be
in
the same
control.
thing.
It's quite fun, it's a bit adventurous rather than just a very
Absolutely.
methodical.
When you battle with premature ejaculation, which can be because, again, sexual trauma or something like that, it's something that you can learn to control. But it takes time and it takes practice, which can be a lot of fun.
Absolutely. Now, Mark, let's just talk about the contributing factors, because you've mentioned nerve endings and sensations and things like that. You've mentioned now possibly a sexual trauma in the past, which can trigger a brain reaction. What other causes or reasons might there be for an orgasmic disorder?
Medication,
Okay.
again, and we look again at your SSRIs, psychiatric medication. Again, some of your blood pressure medication, big culprits
Right.
in this area. Then physical and neurological damage
Okay.
that's happened. But I think the most common and highly contributing factor is previous sexual abuse or trauma.
Okay, okay. And now this is also something that is, as we mentioned earlier, one partner's problem can become the other partner's challenge as well.
Yeah.
So communication being a key factor, as with all of the discussions that we've had in the last couple of weeks, I imagine.
Michael, it boils down to the fact that to have good sex, you have to be a good communicator in your relationship. And if you're not in a relationship, communicate as well. What are your likes? What are your dislikes? What are your preferences? What are your limits, etc., etc. The biggest sex organ is actually the brain. The others are just functional organs.
Right.
But everything happens in the brain. And I think when we get past this fear and of talking about sex, it was interesting. In the 50s, women started demanding sex. And the next sexual revolution was actually women demanding good sex. There's a difference.
Okay, yeah.
Now I think the next sexual revolution is let's talk about sex. It's something that's natural. It's something that's been vilified for a long time. And I think if we are open to discussing just how important sex is for us as human beings, never mind for us in relationships, and for your health and your mental well-being, we've achieved a lot.
Absolutely, and that's why we're having these discussions, Mark. It really is such great value for our viewers. Mark, remind us once again, please, where can people get hold of you if they'd like to discuss further?
Our T clinic is based here in Bryanston, Johannesburg, but we consult all over South Africa, indeed all over the world. Our website's www.tclinic.com, or you can get hold of us on 010-824-1393.
Wonderful. Mark, next week we'll be having our last discussion on sexual disorders, so I look forward to that. In the meantime, it's great to have you with us.
Thank you, Mike.